My endocrinologist, who does a blood test every 3 months, began to notice that my blood levels were declining. And I was at the point where my blood levels were so low that I was on the verge of turning into a myelodysplastic syndrome condition, which opens me up for leukemia. My wife was fearful when she first heard about the diagnosis. My daughter cried. She said, "Daddy, are you going to die?" I was to the point where my doctor said if I even got a small infection, I had to go to the emergency room to be treated, even a cold. My hematologist at Stanford Healthcare, Dr. Zhang, got me into the study with Dr. Bolton.
I'm an assistant professor of medicine at Washington University, and I'm a medical oncologist. A lot of the work that my lab does is trying to understand genetic predisposition that eventually lead them later to develop leukemia.
My brother passed away from AML, and I just knew. I was in total fear of dying from AML because he did.
We're trying to see if we can resolve their abnormal blood counts with treatment with ivosidenib.
This drug and this treatment program has truly changed my life.
Participants don't have to travel to WashU to participate in their care. We thought we could deploy this as a decentralized trial, which essentially means that we have patients all over the country in both urban areas and rural locations.
That allows me to get my medication from Dr. Bolton's pharmacy. They ship me the medication, and Dr. Zhang here at Stanford does all of the testing, and we all share the information.
Patients get their normal care by their provider in the community. We conduct study visits over the phone or over Zoom, just to make sure that people are safe and they're doing well.
I eat healthier now. I exercise more. I think it's really important for studies to look to how we can find ways to treat cancer at the earliest possible stages so it doesn't advance. To me, hope for the future means a lot. It means that I don't have to have the fear of my children losing me, my wife losing me, and that gives me a great deal of comfort. The trial that I'm in is giving me hope that I'm going to see my daughter get married and maybe have a grandchild, and paint many, many more paintings, enjoy many years with my wife and my kids, and maybe a few grandkids along the way.
The drug company, they were really excited by the results of the study that was funded by Gateway. And so the plan was to have the study go on for 18 months, but now we're going to extend the study to go on for 5 years.
My daughter just hugged me when she discovered that the blood levels had returned to normal. Gateway's ability to provide the funding for this trial has saved my life.
The clinical trial really wouldn't have happened otherwise without your support.
I know that this treatment program has helped me to relax, to enjoy life more, to plan forward, have forward-looking thoughts with my wife and my kids. And so it's really opened up a lot of hope for me to continue living for a great many more years.